I want to say just a word about the Institute of Medicine staff that has put this program together. We talked at the very beginning about the program planning committee, which was, of course, hugely important. But I do want to thank Rosemarie Martinez, Kathleen Stratton, who's brand new to this roundtable, and we are so glad to have her. Aaron Rush, who really has been the person that has put this together, and Hope Hare and Colin Fink. But we thank you, and thank you for the whole really well-planned program, but particularly for helping us realize that we're not going to get everything if we don't have somebody help us. And that is, of course, the effort in this last panel to, as it says here, to synthesize what we have heard in these various sessions and to try to pull it together in a way that is helpful to us. So thank you for thinking of that. At least I can use that, and I suspect there may be others, although they're probably ahead of me. In this session, we have a number of presenters who are going to synthesize the various sessions. The first one, session one, the one that is a framing session, will be synthesized by Kimberly Thigpen-Tart, who is in the Office of Program Planning and Evaluation at the National Institute of Environmental Health Sciences. She's been with that institution for a long time, was in the office of the director at one time, and was a news editor of the journal Environmental Health Perspective for many years. And at the moment, her current focus is climate change and global health issues and research policy and translation. So that is, she's going to deal with session one. Session two will be synthesized by Bernie Goldstein, who is a longtime member of this roundtable, emeritus professor of environmental and occupational health, and former dean of the University of Pittsburgh Graduate School of Public Health. Bernie is a physician, board certified in internal medicine, hematology, toxicology, and an elected member of the Institute of Medicine, the National Academies, and the American Society for Clinical Investigation. The fourth session will be synthesized by Hal Zennick, who's a director of the National Health and Environmental Effects Research Laboratory at EPA. Before coming to EPA, he spent 13 years at the University of Cincinnati Medical School in the Department of Environmental Health. And last, the session 5 that we just concluded will be synthesized by Lynn Goldman, our distinguished vice chair of this roundtable, and even more distinguished dean of George Washington University's School of Public Health. So we have approximately, how much time do we have actually here? We have about 40 minutes, and so over to you, Kimberly.